47-year-old man comes to physician for a routine health maintenance exam. He has no complaints and no history of serious illness. He works as a forklift operator in a factory. His brother died of malignant melanoma. He smokes occasionally and drinks a glass of wine once a week. His pulse is 79 and blood pressure is 129/84. Which of the following cause of death in this patient most at the risk for over the next 15 years? A 47-year-old man comes to physician for a routine health maintenance. He has no complaints and all this stuff is given here. So coronary artery disease was the answer because coronary heart disease is the leading cause of death in US and worldwide, and the death rate is higher in men than in women. This patient's risk for coronary heart disease is higher than a non-smoker due to his occasional smoking. Malignancy is the most common of deaths among 45 to 64 years of age. However, the heart disease is more common cause of death than any single type of cancer in the United States. Okay, so this is basically epidemiological question. No need to apply. History of history of occupational disease. Okay, so occupational disease, industrial accidents are the third most common cause of death in American men. Although this patient's occupation as a lift operator increases the risk of accident injuries, his risk of death due to other cause is higher. It can be if coronary heart disease and cancer were not in the option, we would have gone with occupational disease. But here the occupation is basically lift operator. The chances of falling from a lift or any other thing is less compared to patient developing a heart disease. Okay, instead if this was a patient of some coal mine worker, then we could have gone with the coal miners disease, or if exposure to sand, then silicosis or pneumoconiosis. Okay, but here it is an industry. An industrial accident is rare compared to the incidence of coronary artery disease in this population in the United States. So it is basically no knowledge question. It is just a fact which you have to remember.
Thanks for watching. Please give a thumbs up and subscribe for more.